Okay. Moving on now, we're going to look at Chapter 14, which are diseases of the genitourinary system. These are your kidney, typically this is where you're going to have chronic kidney disease, patients who are on dialysis and so on and so forth. Urologists and nephrologists will be dealing with, with this chapter as pretty extensively. The main chapter-specific coding guideline that we have for Chapter 14 is the stages of chronic kidney disease. So under the stages of chronic kidney disease, we have stage 1 through 4, which are N 18.1, 18.2, 18.3, and 18.4. End-stage renal disease, N 18.6, can only be assigned if the patient is on dialysis. Okay, the patient must be on dialysis in order to code N 18.6. And that's really the main coding guideline that's contained in Chapter 14. Otherwise, it's just using the general coding guidelines that we've already learned. So let's take a look at our first. We'll probably just do this first one for time, but we have chronic gout of the left ankle and foot without tophi due to chronic obstructive pyelonephritis associated with kinking of the ureter as a result of Streptococcus group B. So we have the gout, the chronic obstructive pyelonephritis, and the Streptococcus group B. So here's what we're going to do, because I do want to be able to get through the rest of these chapters and have plenty of time for Chapter 19. I would like, we're going to do a team approach here. I would like Christina and Trang to look up the code for the chronic gout, and in the chat put the page in that you can find it and the code. Then Cindy and Dawn, I want you to look up the chronic obstructive pyelonephritis. Elva, Maro, Nicole, go ahead and look up the kinking of the the Streptococcus group B. Okay, so whichever one of you in that team, and then we're going to do the same thing with some of the others that are on the call. Go ahead and look them up. Type in the chat the page that it references in the alphabetical index and the code, and then we'll go and look them up together in the tabular. Okay, Dawn got page 270 and 11.1. Page 159. Let's take a look at that one, the chronic gout. Okay. And this is going to be the left ankle and foot. So we've got the foot joint, M1, that's acute. Let's see, gout chronic, sorry. M1A.37 dash. So we're going to have to go to the tabular to find out more about that code. And then page 293 takes you to the Streptococcus, and it takes us to B95.1 Streptococcus group B. So let's take a look at the N11.1 code. N11.1 is other chronic chronic obstructive pyelonephritis. Okay, so we have that one. Perfect. And then we have the chronic gout of the left ankle and foot without tophus, which is going to be the M1A. Let's take a look at that. Going back to chapter 13. M1A, other secondary chronic gout. Code first, associated condition. So this one is not going to be primary. This is going to be our secondary code. M1A point, nope, it's M1A.3. Chronic gout due to renal impairment. Chronic code first associated renal disease. Okay, perfect. So M1A.372, chronic gout due to renal impairment, left ankle and foot, and we have to take it to the 7th character. So if we go to M1A, chronic gout, in the pink box, it's going to be 0 without tophus, 1 with tophus. So it's going to be M1A.3720, and then followed by the Streptococcus group B, B95.1. So let's see if we got that one right. Yep, N11.1, M1A.3720, and B95.1. Very quickly, go ahead and write these down. Okay, let's take a look at Chapter 15 and Chapter 16 are your chapters for your OB, pregnancy, childbirth, and the puerperium. And Chapter 16 is the perinatal period for newborns. And so Chapter 16 is a very, very short, small chapter. But Chapter 15 has actually seen a tremendous expansion in ICD-10, and the reason for that is because not only do you have to code, and this is typically where you're going to code complications of pregnancy, and the outcomes of pregnancy as well are going to be coded within Chapter 15 and associated Z codes. But sequencing priority in Chapter 15 is very important. So if you would go and look at the under the coding tips, page 84, Obstetric cases, if a patient has a condition and that condition is due to the pregnancy, then it is always coded from this chapter and not the chapter of the condition. So for example, if a patient has gestational diabetes, in other words, diabetes as a result of their pregnancy, it's going to be coded from this chapter and not from chapter 4 like E11.9. It's going to be coded from this chapter. It's going to be an O code. And so the other thing to be careful about is when you are writing down these codes start with the letter O and not 0. It's an O. So many times what I see people do is when they're coding from this chapter, especially if they have the ability to do so, they will use the capital letter O and then a 0. They'll put a mark through to indicate that it's a 0, because these codes can actually have O's and zeros in them. So remember too that in this chapter it is only the maternal record. This chapter does not deal with this is women only, maternal record. The 7th character will, in certain codes, will identify the type of fetus. There's also codes, Z codes, for routine outpatient prenatal visits that would be used in lieu of these O codes for and you'll see what they are. We're gonna take a look at them. Prenatal outpatient visits for high-risk patients. A code from category O09, supervision of high-risk pregnancy, should be used as the first listed diagnosis. Then the secondary Chapter 15 codes would be used in conjunction with those codes if appropriate. Okay, and then the outcome of delivery. If the mother delivers, then the outcome of delivery would come from the Z code, Z37, outcome of delivery. That's included on every maternal record when a delivery has occurred. These codes are not to be used on a subsequent record or on the newborn record. Now, we also, in the OB coding, we must know the trimester and the weeks of gestation, because you're going to be asked to code based on the trimester and based on the weeks of gestation. So be sure that you understand what the trimesters are. So if you go to page 83 of your manual, you'll see what the first trimester is: less than 14 weeks and 0 days. The second trimester is 14 to less than 28 weeks, and so on and so forth. Keep that in mind when you're reading the notes where it says patient is 14.2 weeks pregnant. Then you'll know that that patient is in the second trimester and not the first trimester. So must be very careful about that, because it's going to be a different code. And so let's as far as the selection, the long-term use of insulin and oral hypoglycemic, you can find the coding guidelines for that on page 87. So it should be assigned if the patient is being given long-term. Now, if they're just being given the insulin, 1 or 2 times to control their blood sugar, then you would not use that Z code. Okay, and also there's been a title change to termination of pregnancy and spontaneous abortions instead of miscarriage. So now it's called a spontaneous abortion instead of a miscarriage. So let's kind of take a look at these coding guidelines. We have patient pre-existing diabetes type 2 in pregnant patient with long-term insulin use of the 3rd trimester. We'll do just this one. So let's go to Tanya and Trang. You will look at the pre-existing diabetes type 2 in the pregnant patient. Nicole and Mauro, look up the long-term insulin use. And I am just going to tell you about the trimester because I didn't tell you what that was. The trimester, no, I'll let you guys look that up. Let's take a look at the pre-existing diabetes type 2. So we're going to code the pregnant patient with diabetes type 2, but they also have pre-existing diabetes type 2. So we're going to code the, Tanya and Trang, you code the pre-existing diabetes type 2. That's going to be the E code. Then you're going to have Mauro and Nicole code the type 2 diabetes in the pregnant patient, and then long-term insulin use will be Christina and Elva. Okay, Trang already got the pregnant diabetes type 2, which is O24.113. Let's take a look at that. O24.113, pre-existing type 2 diabetes mellitus in pregnancy, third trimester. Beautiful. It says under O24.1, use additional code from category E11 to further identify any manifestations, and long-term current use of insulin Z79.4. So Z79.4 is going to be the third code, and then the second code is going to be E11.9. Okay? I'm going to give you just a few seconds for this. And then what we're going to do to make sure that we get to Chapter 19, we're going to go straight to Chapter 18. Chapter 16 and Chapter 17, certain conditions arising in the perinatal period, and Chapter 17, which are congenital conditions, deformations, and abnormalities, have they really don't have any chapter-specific coding guidelines, with the exception of in the perinatal period. We have some coding guidelines for low birth weight and immaturity status, bacterial sepsis of a newborn and stillbirth guidelines. You can read through those on page 91. Be sure to do that before doing your coding exercises. And then for Chapter 17, which is another very small chapter, congenital malformations, deformations, and chromosomal abnormalities. These are your genetic conditions. And so, you know, there are no chapter-specific guidelines for that particular chapter. So again, just make sure you know the general coding guidelines. You'll be looking them up the same way you would look up other codes that use only general coding guidelines. So with all of that said, and I know that's a mouthful, let's move directly to Chapter 18, because Chapter 18, I just want to make sure you're comfortable with the signs, symptoms, abnormal and clinical findings not elsewhere classified. And again, we probably won't have to go through some, well, we'll go through a couple of, maybe one coding exercise from Chapter 18. But the main thing about Chapter 18, if you go to the coding tips on page 97, it says Chapter 18 includes symptoms, signs, abnormal results, clinical or other investigative procedures, and ill-defined conditions regarding which no diagnosis classifiable elsewhere is recorded. So basically, this is taking you to a place where you have a patient that has come in for treatment of some type of a condition, and we don't know what that condition is until we complete further testing, okay? And so in the event that a patient leaves an encounter or completes an encounter without a definitive diagnosis, to diagnose a sign and symptom would be appropriate, okay? Just a couple of coding tips. If a patient has a history of repeated falls, you know, I keep falling, is for use for encounters when a patient is recently fallen and the reason for the fall is being investigated. You know, I was in my chair, I was sleeping, something startled me, I stood up really quickly, and all of a sudden I just passed out and I fell. And I don't know why. And so, and they don't have a history of falling. But if they have a history of falling, this is for use when a patient has fallen in the past and is at risk for future falls. When appropriate, both repeated falls and a history of falling can be assigned together. So you can, a patient may come in and say, I fell, this is what happened, I don't know why, it's not like the last time I fell, and so you can have the repeated fall and then also annotate though that this patient has had a history of falling. The coma scale is used only for coma patients. It's very, very rarely, you know, it's a very, very specialized type of coding. I would doubt, there may be someone on this call who does code patients in coma, and if so, then you would need to know how to code from the coma scale, and be sure you know that. So let's just look at one very, very quickly. We're going to look at number 2, vomiting without nausea. Let's quickly look it up. Somebody give us the page in the index where you can find this, and then we'll go look at it in the chapter, in the tabular. And then we're going to move right into chapter 19. Page 322. And what is the code? Elva's killing it, man. Somebody have the code? R11.11. Let's take a look at it. R11.1 is vomiting. R11.11, vomiting without nausea. Perfect. Okay. Now this will be number 5 will be a good homework project. Okay. Take the op note apart, separate it out, so you have all of the different codes. Look through your the coding manual. Make sure you're reading the coding guidelines for ordering the codes, and you'll notice that the R code, the 2 R codes, are at the very end: abnormal ECG and EKG, and abnormal results of kidney function test. Those are just, again, signs and symptoms. The encounter was for the cardiovascular exam, and then you had underdosing and so on and so forth. So let's move directly now to chapter 19, and let's talk about coding of injuries. This is going to be in chapter 19. You're going to look at the, first of all, go to page 100 of your manual, and you'll see that you have traumatic injuries of all of the parts of the body, not just the musculoskeletal system, but organs as well, okay? And then you also have your T codes, which are injuries involving multiple body regions, T14 injury of unspecified body regions, and then you have T15 through 19 is effects of foreign body entering through natural orifice, like a marble up the nose, okay, is somewhere in there. Then you have your burns and corrosions. Be aware that burns and corrosions are now separated out in ICD-10 where they were not in ICD-9. Burns are lesions that are due to heat or cold. Corrosions are burns essentially that are due to chemicals. So corrosions are chemical burns. You also have your poisoning codes, which are your T36 through T50 codes, and your toxic effects of substances chiefly non-medical as to source, like poison ivy, okay. T66 through 78 are your other and unspecified effects of external causes, certain early complications of trauma, and then T80 through 88 are complications of surgical and medical care not elsewhere classified. Chapter 19 and Chapter 20 are companion chapters because in most cases when you code from Chapter 19, you're also going to have to code from Chapter 20. So before we do any coding in Chapter 19, I would like you to go to your workbook and I would like you to go to page 113. Yes, page 113. And this is going to be your external, these are going to be your external causes. And I want to explain to you what those are so it will help you when you're coding your injuries. You can't really code your injuries properly unless you know how to code out of Chapter 20. So this chapter, it says here, this chapter permits the classification of environmental events and circumstances as the cause of injury and other adverse effects. Where a code from this section is applicable, it is intended, number one, that it should be used secondary to a code from another chapter of a classification. So most often the condition will be classifiable to Chapter 19, okay? And so, number one, Chapter 20 never, ever, ever is used as a primary diagnosis, okay? It will always be secondary, okay? And there is an order in which the external causes should be notated. So if you look at 113, you see in the middle it says 1 through 5, how the injury happened, the intent of the injury, was it unintentional, accidental, or intentional, such as suicide or assault, the place where it occurred or place of occurrence, the activity of the patient at the time of the event, and the person's status. And so when you're sequencing external cause codes, you're going to want to use this sequencing. Now, your op notes may not always contain enough information to code every single one of these. But if you have, for example, how the injury occurred, the place where it occurred, and the activity, then you would code 1, 3, and 4 in that order. You may not know the intent. You may not know what that person's status is, okay? And so be sure that when you're coding the external causes in conjunction with the codes from Chapter 19, that you're coding them in the correct order. So now we're going to go back to Chapter 19 and we're going to pretty much finish up our night with a coding exercise. And the coding exercise that we're going to do together is number 5, okay? Now I want you to remember something. We have, within number 5, we have the, I'm sorry, is this the right one? Nope, it's not. Hold on a second. Chapter 19, let's move over. Here we go. There we go. We're going to code number 3 together. The 13-year-old male is brought by ambulance to the local ER after falling on a skateboard ramp at the local public park. The fall resulted in an open fracture of the coccyx bone that will require surgery. So one of the things also, when you're coding fractures and when you're coding burns, the main thing to remember is in multiple fractures and multiple burns, you will code them by order of severity. So the most acute, the worst fractures, and of course a fracture can be an open fracture or a closed fracture. A closed fracture is a bone that is broken, but the skin has not been compromised. In an open fracture, you can actually see the bone poking through the skin, okay? Or if there's a gash and you can see the fractured bone. That's an open fracture. If in the op note, the fracture is not specified as open or closed, then you're going to always code it as a closed fracture if it's not specified in the op note. But if it is specified as an open fracture like this one is, then you're going to code it as an open fracture, okay? So what I want to do is I want to take a little bit of time now to take this apart. We have 1, 2, 3, 4, 5, 6 different codes, okay? No, 1, 2, 3, 4, 5 codes. Sorry, and when you're looking at this, there's a lot of information. But the first thing we have to find is, what does this patient have? Because that's going to be the primary diagnosis. It's not going to be the skateboard fall. It's not going to be that they were transported by an ambulance. It's not going to be that it was at the local park. It's that the fall resulted in an open fracture of the coccyx bone that will require surgery. So let's look up the open fracture. So what you do is you go, number one, to the keyword index and you look up fracture. And you look up fracture traumatic, because this is not a pathological fracture. And then we're going to look up the coccyx by anatomical site. So that is going to be on page 149, almost halfway down. We have S32.2, and then it gives you a dash and a check mark. So now at that point, we have got to go back to chapter 19, and we've got to look up S32. Fracture of lumbar spine and pelvis is S32, and the coccyx is one of the bones of the lumbar spine, okay? And so under S32, under the main term, which is on page 918 of your 2017 book, you have a pink box. It says the appropriate 7th character. Almost all of the codes in chapter 19 are going to go to the 7th digit. And you always have to look for that pink box for the appropriate 7th character extension. So we have A, B, D, G, K, and S as choices, A being an initial encounter for closed fracture, initial encounter for open fracture, and so on and so forth. So this 13-year-old male is brought by the ambulance to the local ER. So this is going to be an initial encounter, okay? This isn't a subsequent encounter, obviously. The fall resulted in an open fracture of the coccyx, and we determined that to be S32.2. So let's go to S32.2, fracture of coccyx, and it is on page 919, and you have a 4-digit code that it is telling you to take out to the 7th digit. Wow. So basically, this is where our coding convention of the placeholder comes in. So the first code is going to be S32.2, and this is an open fracture initial, which means if we go back to the pink box, it's going to be a B is going to be our 7th character extension. It's going to be S32.2, and we have to put that on the 7th character, so it is going to be XXB, because we have to use 2 X's to place hold that code. Now, the next thing that we need to do is figure out where the fall took place. And so if we go now back to chapter 20, the place, how the injury or health condition happened, or the cause. The cause was the fall from fall on the skateboard ramp. And so from there, what we're going to do is we're going to go to the index, but we have to go to the external cause index. And we're going to look up the place, which would be a ramp. Is there a ramp? Is there, not the place, but the external cause would be a fall, okay? And then from fall, it would be ramp, W10.2, 416, about 2/3 of the way down. So that's going to be your next code, W10.2. There's a checkbox. So now we have to go to Chapter 20. So you see how now we're going between Chapter 19 and 20. So now we go to W10.2. So it's fall on from incline or from ramp, and it has to go to the 7th character. So now we have W10.2, and what is the 7th character in this one? We have to go back to the W, which is going to be the initial, subsequent, or sequela. This is an initial encounter, so it's going to be W10.2 XXA. Then the place of occurrence is the next, remember? So number 3 is place of occurrence. Where did it take place? It took place in the local public park. So now you're going to go back to your external cause index. You're going to look up place of occurrence. Which is under P, and look for park. Place of occurrence, park, public. Page 422, about halfway down, park public Y92.830. Let's look that one up. Make sure that there's no additional digits that we have to code. Y92.890. I'm sorry, 830. Y92.830, public park as the place of occurrence of the external cause. So that would be your next code would be Y92.830. And then the activity would be skateboarding. So then you go back to the external cause and you look up activity. And that is going to be on page 406. And they actually have skateboarding. Yes, they do. Y93.51. And I came up with a different external cause code than is in the answer. Let me take a look at what I came up with. I came up with also, and again, we have a fall from fall on the ramp, from the ramp, but we also have the fall off the skateboard. So I had a skateboard accident on mine, V00.131A, which is fall from skateboard. So I actually had S32.2XXB, W10.2.XXA, V00.131A, Y92.830, and Y93.51. Now, for some reason, I'm not sure that, and again, this does open for interpretation as you get down into these external cause codes. There's a Y, they don't have the V00.131, but they have Y99.8 other external cause. So I'm not sure where that comes from, that other external cause, because really everything is encapsulated in this op note. So with all of that said, you know, the final chapter, which is chapter 21, are your Z codes. Let me just show those to you very, very quickly, because I know that we're at the end of our time. And your Z codes, these are factors influencing health status. And generally, these are going to be codes that represent patient history, history of falls, history of tobacco use, etc., but also different types of routine encounters. So, for example, there is one called the supervision of routine pregnancy. So when a patient comes in the middle of their pregnancy for just a routine visit, they would use that Z code instead of a code from chapter 15. There are annual wellness exam codes. There are codes for immunizations. There are codes for different types of counseling. So if a patient goes to their OB for birth control counseling, there's a Z code for that. And for certain kinds of genetic testing. So there are Z codes for those as well. So be aware of that. They're fairly easy to code. General coding guidelines apply. The main thing with the Z codes is that they're only to be used for routine types of visits. If there are complications, and there is a Z code for a routine exam with complications, so if complication is discovered, then you would code the Z code along with the complications. So those are just the main items from the Z codes that you would need to know about. And of course, you do have the exercises from chapter 21, and this would give you some of the Z codes that would be used. And so, really and truly, folks, I'm amazed that I didn't see anybody fall off the call. You all stayed with me for the whole 3 hours. Very, very proud of that, and I hope that these 6 hours that we were together these last couple of nights have helped you become more adept and more comfortable with the entire ICD-10 coding process, and that you are going to feel more comfortable with your coding for your providers and so on and so forth. Make sure you do the independent study assignments, which are all of the rest of the coding exercises that we didn't get to in each chapter. And also, at the end of this presentation, you are going to be asked to do a little survey about this webinar and how you liked it. Your feedback is very, very valuable to me. Anything that I can do to do a better job for you, I'm always open to. Anything that PMI can do better, please give us the good and give us the bad, but give us the good too. And thank you so much for your time tonight, and God bless.
Thank you, Lisa. If you do have any questions, you can post them to our discussion forum that's listed here. And the email that someone asked me on the email address, you can send an email to info@cmisd.com with any questions, or you can also post to the discussion forum, and those will get forwarded along to Lisa. We hope you've enjoyed this presentation from Practice Management Institute. For a complete list of upcoming webinars and other courses, please visit our website at www.pmimt.com. And this is our final session, and we would like to thank you for joining us, and we hope to see you at another webinar